So my name is Jamie Green. I'm a colonel with the New York Army National Guard. I work for MedCom, so I'm on the joint staff, and I'm the commander of MedCom. My hometown is Saratoga Springs, New York. As I was brought in to help engage the medical forces and create a hospital. So they needed somebody here with medical training to help organize and set up the hospital. One of the biggest challenges with setting up the hospital is creating a work environment where multiple agencies, probably 30 to be exact, can work together, each with their own chains of command. They all come from disparate worlds and they had to work together. So we have active duty, we have National Guard, we have city agencies, state agencies, federal agencies, all with their own bosses that are demanding of them, but also having to work with each other to create this place in short order that was probably the biggest challenge. I think what I'm most proud of is the fact that we made all the agencies here on the deck work together. And everybody at ground level worked together. Everyone was motivated to get this done in an extremely short period of time. This tasking is different from my other deployments in that most of the other deployments have been combat related. So it's a little different when we work with civilians. I've been to storm responses and emergency calls, but this one was different because we're military and civilian organizations working together to treat civilians. And we're used to treating just uniformed personnel, so there's a lot of differences in how those things are done. So if you think about what we've done, okay? We have a capacity in this hospital of 3,500 beds. We've created in 4 weeks a hospital that's bigger than any other hospital in the country. As our capacity rises, we'll become a full hospital bigger than any other hospital in the country. That's the thing that I try to think about and think about what we're doing. You know, how many hospitals have been around for 100 years and they've worked these systems out? We're doing it in 4 weeks from scratch, turning a convention center into a hospital. I also think that it's okay if we build this thing and nobody comes, because at least it was there for the city of New York, and if it's not being used to its capacity, that's actually a good thing, because that means less people are sick or need it.